Well, people are misunderstood on what Safe Montana stands for. We believe in medical marijuana. So my suggestion is that we go to the FDA, take the good things that are in marijuana, bring them down to Schedule 2, just like they did with Santavex, Sesament, and Marinol, the first 3 marijuana products that they've done that, and run them through the system. 2 of them already got approved, and those vet doctors can hand that out.
They confirmed what Rosenfeld was saying all along, that cannabis works on pain, especially pain that does not respond to opiates.
All of them, to some extent or another, demonstrated that smoked marijuana is effective in this situation for which we really don't have very good treatments.
Test it, they measure it, they don't smoke it, they take it in a pill form, and we need to go back into the 17th session and put in medical marijuana that's the correct way, like I mentioned earlier, or just run it all through the FDA like they already have Sesament, Marinol, and Santavex. They've got marijuana products going through the FDA. That's the right way to do it.
Provide a pill that can do what the plant does. For years, the government had been sponsoring and funding research to put the active ingredient in marijuana, THC, into a capsule form. Known as dronabinol or Marinol, the drug is a synthetic version of THC created in the laboratory. Since it did not come directly from the plant, the DEA placed it on Schedule 2.
They wanted to have an answer to people like me. There is a medicine out there that people can buy. They don't have to use herbal marijuana.
Dr. Grinspoon says the problem is Marinol does not work as well as marijuana.
You take people who have used both herbal marijuana, smoked it or ingested it, and Marinol or dronabinol. Every time, never an exception. Oh, I much prefer herbal marijuana.
It was my experience when AIDS patients first started taking dronabinol back in 1992 that they didn't like it. The absorption when taken orally of THC is very variable and low.
The gut only absorbs 12%, plus or minus a few percent depending on the individual. The problem with taking it through the gut, you have to wait for an hour and a half to 2 hours to know whether you're getting relief from the pain or the nausea or whatever it is you're trying to relieve.
How does Marinol compare in all this? I was talking earlier. I mean, do you feel like it's as effective as the plant or no?
No. I do not believe Marinol is as effective as marijuana or THC.
And why do you say that?
I've never really seen it work. We've had it on, it's expensive, and I've never had a patient who seemed to get much benefit from it.
We really haven't had very much success with patients with Marinol for any side effect management. So there's something that is lost in with the THC in that processing.
Dr. Abrams says what's lost in the processing are all the other cannabinoids in the plant, some of which are known to mitigate the high associated with THC, making the patient feel more relaxed instead of anxious.
There are 400 other compounds in the plant, including 70 other sort of lookalikes to delta-9 THC, and those are all there for a reason. They provide balance, if you will, the yin and the yang, and my opinion that you lose that balance when you remove the single most psychoactive component from the plant and use that as a pharmaceutical.